at SciCom now, so that's also encouraging, and hopefully some are on this call or will be joining shortly. So hopefully we'll have more of these more frequently in the future. But today, Corlia is going to present some work that we did as part of the research on COVID, which seems to be a bit of a fading memory now, at least here. It's starting to get that way. For those who joined from overseas, there was an announcement last night that we don't have to wear masks anymore. So we've been wearing masks until 2 days ago. And today I dropped someone off at school and there wasn't a mask in sight, and that was quite unusual to see. And I think we're now back to full gatherings as well. So lectures and everything should be back to full capacity. So for the time being, at least, things are back to normal. But of course, when we undertook this research, it was a very different time and a different world. And we were very curious to see what was happening in the media in particular and how they were reporting on COVID. So Corlia led this piece of research to look at various newspapers and how they framed COVID in at least the South African news media. So Corlia, I'm not going to take any more time. I'm going to hand over to you. Anyone has questions? Corlia, do you want to take them as you go along, or should we wait till the end? What's your preference?
I think I prefer the end because you're going to help me answer questions.
Okay. So yeah, we'll take questions at the end. Just jot them down as we go along. Corlia, probably 15 to 20 minutes, no more than that, and then hopefully we'll have more discussion than just presentation. And we really look forward to your feedback and input. Just one of the reasons for holding this colloquium is to improve on the work that we're all doing and to build a bit more of a community around the research that we are undertaking. So Corlia, I'm going to turn off my camera and hand over to you. Thanks, Corlia.
Thank you. Just going to do the little screen share here. Is it sharing or not?
Yeah.
Can you see? Okay.
Full screen, maybe.
There we go. Hold on. There we go.
Yeah.
So thank you, Francois. Morning, everyone. Thank you for the opportunity here from the SciCom team to speak about our research, and then Fumani for setting this up today. And then specifically thank you to Francois, who came on as a co-author kind of halfway through the project because I panicked. So I asked him to help me. So thank you so much. And I'm very happy that we can present this research that's been like 2 years in the making. So since we have quite limited time today, I'm just going to go briefly through the introduction and the research questions, and then I'll discuss our methods, some descriptive stats, results, and just a short conclusion on the research. But before I get to that, when the COVID pandemic hit, I knew nothing about framing research. I didn't really know anything about communicating health in the media. So this was quite a learning experience, and I've learned a lot, and I'm hoping this is information I can continue to use in the future. So as we all know, and we've all seen and heard about the dates, but just a quick reminder is that COVID hit us all. It was first announced in the media after it hit China in December 2019. And then the virus spread quite rapidly through the globe. And then in March 2020 is when the World Health Organization declared a global pandemic. That was declared before we had our first case here in South Africa, so that was quite interesting. And I mean, since then and up to today, even though the death rates and everything has slowed down, but there has been so many infections and deaths. So it's been quite an interesting case and a unique case because it's been similar in both developed and developing nations. And then I think which is specifically interesting is this like a wealth of information that was readily available to everyone, politicians, scientists, journalists, and the public, which makes it quite an interesting case to study the communication of it. But with this wealth of information comes quite a big responsibility and a lot of pressure that was put on journalists and scientists to communicate. And then with that comes do you prioritize newsworthiness over the scientific integrity? Because that will influence the public health ultimately. So what we know about the functioning and the impact of the media becomes critical in these terms in designing and implementing the regulatory environment as well as policies so that we can have a constructive role of the media as a source of health information. So with that light, we wanted to see how things were framed in the media, how people were covering the media. I'm not really sure what triggered my interest in that, but this was part of a larger project where we looked at a bunch of various aspects of COVID and how it was communicated. But we were specifically looking at framing, and researchers looked at how events have been framed in the media for the longest period of time, and over time periods and short periods and longer periods. But for this research, we defined frames as schemes of interpretations that guide people to make sense of the experiences of the world around them, of events that they are experiencing, by categorizing and organizing and interpreting this information. And at the basis of the framing theory is that the media focuses the attention on selected events and then places them within a field of meaning or reasoning. And then how this event is then presented to the media will, as the theory states, will ultimately influence how the information is processed and perceived, and then consequently how people use this to make decisions or choices in their lives. So we take this position of the framing approach and the theoretical framework that comes with it, that it continues to evolve and then adds value to the terms of understanding of the effects of the mediated communication on society, and in this case, of the communication of health on society. So against all of this backdrop, which is obviously discussed in way more detail, but with a time limit, you kind of have to pick and choose what you want to talk about. But against this backdrop, we present a framing analysis of the coverage of the COVID-19, news coverage of the COVID-19 pandemic in South Africa. We don't know of any other long-term empirical study on the framing of the pandemic in South Africa, or not the last time we checked. So we are trying to fill a gap in the research by comparing different news media, different newspaper in South Africa over a long period of time, 22 months. Sometimes I will refer to it as 2 years. And the research questions I will be discussing today is how did the South African news media frame the COVID news stories during the pandemic? How did the framing change over the period of time, and then how does it differ across the different newspapers we are looking at? What was the tone of the news stories, and then how did the tones change over time? We did look at the tone between the newspapers itself, the publishing houses, but they didn't change, so I will not be reporting on that today. We adopted a quantitative content analysis because that's kind of been widely used in communication research and in communication studies. We selected 3 South African newspapers that has been published, that currently gets published in print and online. They're all weekly newspapers. It was the Daily Sun, the Star, and the Business Day. The selection was based on the status that they are national newspapers with quite large circulations. They are dailies and tabloids, and they have been proved to be quite important in opinion making in South Africa. The Daily Sun was selected because it's the largest tabloid newspapers in South Africa. The Business Day was selected because it is the largest economic and financial national newspaper, and then the Star was selected because it reports on daily, national, and local news. None of these newspapers publish over weekends, and they were selected because they're all from different publishing houses. And the selection was very specifically done so that we don't duplicate in the sample any political or ideological bias as part of the publisher. So after we selected our newspaper, we realized that 2 years is a long time, so we very specifically looked at 6 time periods in the 2-year time. So the study period was on the 1st of March until the from 2020 until the 31st of December 2021. And that was the start of the pandemic in South Africa, and then when we basically finished our data collection. But then from there we selected 6 periods because there were noticeable time periods in the pandemic here in South Africa. So the first time period, 18 March until 1st March 2020, was when the virus reached South Africa, and the government enforced its 21-day national lockdown. Then on the 17th to the 30th of June 2020, South Africa lowered its level in lockdown, and schools and universities started opening and people were allowed back to work, and things just eased up a little bit. Then 28 December 2020 till the 8th of January 2021 was when our COVID cases reached 1 million. But in that time period was also when lockdown measures were tightened again because of the new South African variant, which came with a second wave of infections, and beaches were closed and public parks were closed, and there was limits placed on gatherings again. Then the fourth time section of the 15th to the 26th of January 2021, the South
I think we might have lost Corlia. It may be that their power is switching over from the backup generator to the mains again. So just bear with us a few minutes. Maybe if anyone on the call has any comments or questions while we wait for Corlia to come back, please feel free to chip in. Apologies for the interruption. Yeah, Wilma, go ahead.
Hi there. I was wondering, the selection of newspaper, of print media, what was the reasoning for that, and what was broadcast and online media considered at all, or just kind of, if you could extrapolate on the motivation for just using print media and not other sources as well?
Yeah, so it's a section in the paper where we talk about the selection in more detail, but from what I can remember, we drew on some stats showing that certainly online news is growing quite rapidly in relation to other news sources, particularly print, and all three sources have both online and print. So it's not that we're choosing the one over the other. I mean, we don't know always, who's read a print copy or an online copy. What we get from the data is a link to an online page. So we're presuming that also appeared in print. So that was kind of the thinking behind the type of media. For the three newspapers, what we try to do is think about a coverage across a spectrum. So Daily Sun being more popular and sensationalist, I guess you could say. And on the other extreme would be the Business Day, that would be far more conservative and covering business news, which introduces some biases, we acknowledge. And then in the middle would be the Star newspaper, which we see as kind of a balance between the two. That was certainly our understanding, but I mean, you're welcome to comment and say whether you think that's a good enough justification, or whether there were other media sources that or other print/online media sources that maybe we should have considered.
I do but like your reasoning behind that. I also see that by selecting these newspapers, you are actually covering online or print as well as online, because these they all have online platforms, and the stories used in print is probably used on online platforms as well. Just one comment. I know, for instance, that News24 is considered the biggest online platform, or the biggest news platform in the country at the moment. So that maybe going forward would have been something to consider as well.
Yep, no, I agree. So I mean, News24 we've certainly used in other studies, with Health24, because it's sort of the same house. Media house, but they don't do anything in print. So, I think that might have been an issue in terms of the selection, but I agree with you, that's certainly the broadest reach if we were looking for that. Corlia, are you back?
Yes, I'm back. Sorry about that, everyone.
No problem. We were doing just fine. Wilma just asked a question about the media sources that we chose. So we just spoke about that while you were switching over. So you can pick it up where you left off. I think you got cut off.
Is the screen sharing again?
Well, I can see lots of leopards and leaves now, but
okay, hold on. There.
Yeah.
Okay, great.
I think talking about phase 4. I think when we lost you.
Okay, great. Sorry about that. I knew that was going to happen. Okay, back to it. So phase 4 was when the vaccine rollout started for South Africa. Then the 5th phase, 10 to 21 May 2021, we had our first wave of infection that hit South Africa. The Omicron variant was then identified. No, my apologies. That was when the new lockdown measures were implemented again. And then the last one was when Omicron variant was identified. That was in November to December 2021. And the 4th wave of infections hit South Africa. So after we have our newspapers, we have our time periods, we had to actually select some articles. So the first step in that is that we sourced articles from Pair Media, which is a media tracking service in South Africa. And the articles were sourced part of the larger project about COVID. And the keywords that were used were Corona, COVID, and lockdown. This resulted in a lot of articles, 3,651, and that was too much. So we had to take it a step further. And then we selected articles with the words Corona, COVID, virus, vaccine, and vaccination in the titles or headlines. I might use those words interchangeably. After that step, we have to filter through to make sure we only select content-based articles. So therefore, we excluded articles that were letters or headlines that only didn't have an article attached to it. For example, just a picture, editorials, opinion pieces, and advertisements were also excluded. And then the last step is we had to filter through to see if we and remove all the duplicates, of which we kept the most recent one that was published. And that ended up with us with a total sample of 524 articles between the 3 newspapers. To answer the research questions of how the articles were framed during the pandemic, we used a single article headline or title as our unit of analysis. This was after a lot of deliberation. We decided to do this because there is a lot of research that supports doing that. And it also allowed us to do a bigger analysis or analyze more within the constraints of our resources that we had. But also that actually attracts people's attention. That's the first thing that people see when they open an article or scroll through something on the internet. And it's the first initial frame that activates a reader's cognitive schema. We did test it. So when we were testing for intercoder reliability, we saw that there was a large similarity between coding the headlines and the full text, the body text of the article. So that's why we decided to go on and use that as a unit of analysis. We used 2 code sets for framing, and we were determined both of these sets with a deductive approach. And the first test was based on Bush and colleagues' 2020 paper on the coverage of the pandemic in US newspapers. And then the second set was on Morris and colleagues' 2020 paper, where they looked at the coverage of COVID and specifically the tone of the newspaper articles in Malaysian and Indonesian newspapers. But we would like to just acknowledge that even though these papers use similar frameworks of their coverage, we do realize that there is differences in the country context. But I think that makes it very special that we will both be able to use both of these frames in our paper. This resulted in a very detailed code book where we coded for article number just for logistics reasons, and then the headline, the newspaper name, the publication date, the frame codes, and then the tone codes. We can move on to our descriptive statistics. So like I said, our total sample was 524 articles. of which almost 50% was in the Star, 260 articles. So that was the one that had the most articles, that was followed then by the Business Day and then the Daily Sun. And of all these headlines, we coded a total of 782 frames. Oh, something I just forgot to mention earlier in the previous slide is that we had 11 frames, and they had a total of 43 subcategories. I will mention some subcategories, but we did code using the 11 frames. So back to the slide. The total number of headlines, as you can see, did decrease over the period, where the most occurred in the beginning of the pandemic. So the highest coverage was in the first time period of 33% of the articles that occurred in that time period. And then it decreased in headlines, but then it did slightly increase again in November and December of 2021. Also, the reason why they could be 782 frames is because we coded up to 4 frames per article headline. So our first recent question asked is, how did it just in general frame news stories during the pandemic? And the frame that occurred the most, or the news frame of the entire, was the population and community issues frames, and that included subcategories, for example, of stories of affected individuals, lockdown, stories of hope, stories of people being confused, crime, and lockdowns. This was then followed by the economy frame, which you can see there is EE, and that was subcategories like financial impact and supply chain and event cancellations, everything that played a significant role on the economy of people individually, but as well as South Africa. And then the frame that's third most used was the COVID epidemiology frame, and that was a lot of statistics surrounding the virus, as well as information about the virus, testing and screening, the transmission, outbreaks. And then that little table is just a representation with illustrative examples of headlines that you could have found for each of those codes. Then how did it change in the time period, the code? So our research question 2 asked how it changed during the first years of the pandemic, and a cross-tabulation revealed that there were different frames. There were significant differences for 5 of the 6 time periods, so it's not frames. So headlines that framed as population and community issues, that is PI, was significantly more prominent in the beginning of the pandemic, so that would be the brown line here. And similarly for economic, government response, and the community mitigation, that would be economic is EE, government response is GR, and community mitigation is CM. Those were all frames that was actually most prevalent in the first period, the first section here. The only frame that was used more significantly in the middle of the 22 months period was the symptoms, treatment, and vaccine period, which is here, which is denoted by S over here. And that was in the December, January, as well as the February of 2021 time period. How did it differ across from news media? And there were 5 frames that were significantly different across these 3 newspapers. So the economic frame, kind of as expected, was most prevalent in the Business Day. Then it was followed by the Star. The infodemic and indiscrimination frame, which is ID, was most prevalent in the Daily Sun, and then also followed by the Star. And then frames about symptoms, treatments, and vaccine was most prevalent in the Star, but it occurred the least in the Daily Sun. And then this is the only time I'm going to mention, but frames about sport, which is SS, was the most frequent in the Daily Sun. So next up, we wanted to look at the tones of the stories. We wanted to specifically differentiate between tone and frames. And we analyzed the sample for with 4 tones: alarming, reassuring, neutral, and mixed. Mixed tone is as the name states, is a mixture of alarming and reassuring that was used both in the headline. So the most frequently occurring tone was the alarming tone, with just over 40% of the articles stating that, well, being coded for as alarming, and that was then followed by the neutral tone and then the reassurance tone. Each of the articles could only be coded with one of these tones because we made a mixed code. There again is just some illustrations of what a headline can look like for each tone. And then the last research question is just how did the tone of the news stories reporting COVID change in South Africa? So there were significant differences in the tones used over the 6 months, the 6 time periods that was analyzed. The alarming tone was used the most in the first period of March, and then it went down into the June period and then into the November. It was used the third most in the November-December period. So it went down and then went back up as the time went past. The reassuring tone was used most frequently in the March period, followed by the February period, and then similarly the neutral tone occurred again also the most in the beginning of the pandemic. So that was just a brief discussion results where I can now move on to the discussion, which will just explain a little bit more. So our major objective of our research was to determine how the COVID was framed in the news media during the first 2 years of the pandemic, as stated before, from March 2020 until December 2021. And we do believe that our results is the first description of a longer term newspaper coverage analysis of the pandemic in South Africa. So the descriptive statistics do show a decline in the media's coverage over time, and that's actually quite expected because as the pandemic diminished and there was more greater certainty about the virus, they didn't really report on it because everyday struggles and activities still happen in South Africa. So scientists increased and we knew a little bit more, so the newsworthiness declined of the pandemic. But the increase again in the end of the time period, November 2021, actually corresponds with the new variant that was discovered in South Africa that led to renewed levels of uncertainty and fear, which makes sense, and therefore the news coverage increased, because also this variant was also perceived as more threatening than other previous variants. So that goes hand in hand with why there was an increase of the news coverage. The pandemic was mostly framed in terms of social impacts on communities all across South Africa. And these stories dealt with the impact of the lockdowns, of confusion, of crime, on the influence on educational institutions. And again, this is actually quite expected considering that 2 of these newspapers have a very large readership, and the one is considered a tabloid more so than the others. And tabloids are known to cover stories in a very sensationalist manner. But the focus on the societal effects of the virus could also be attributed to a high level of uncertainty surrounding the COVID virus, which leads to the news media turning its attention to more individual consequences like businesses closing or well-known personalities and celebrities contracting the virus, also recovering from the virus. So other researchers have pinpointed that the focus of how the COVID media is framed can actually be more because of a threat of how we live our lives or a threat to how we know life to be rather than a serious health threat. Framing the pandemic as an economic issue is also quite prominent, but again, unsurprising, because we included a business-focused and financial-focused newspaper. But also because the economic impact of the virus in South Africa. And this was illustrated by news stories about businesses closing and people losing their jobs. And then the first most common frames used in the news was the epidemiology frame. And this included statistics about COVID, information about the outbreaks, the transmission of the disease, the testing and screening. We knew nothing about this virus when it started out, and the pandemic was quite unprecedented in terms of the pace of scientific discovery, in terms of the data that was collected and published and made public all over the world. So the media appears to have capitalized in the availability of the scientific data and the information during the pandemic and used that to keep readers informed in developments of the pandemic. And then lastly, the data on the tone of the media headlines did suggest that the reporting of the COVID might not be completely driven by motivations to inform the public in a neutral and calm and objective manner, but rather that the news uses the alarming tone to point to the dangers of the pandemic and create more of a sensation around the pandemic, rather than using a calmer, more encouraging tone to provide information to the public. So to conclude, we used 3 South African newspapers to study the framing of the COVID pandemic in South Africa, and there were 3 dominant themes that came out of that, and that was the community theme, the economic theme, and then the epidemiology theme. There were significant differences between the frames of the newspapers, which supports our conclusion that attention was predominantly a driver behind the pandemic. Now, while this study is very important to understanding of how COVID is framed and then how other health issues could also potentially be framed, we do have 2 distinct limitations that could be addressed in future research. And the one is that we only use South African newspapers. So more research can be done to include newspapers published in any of the 10 other official languages in South Africa. And then the second limitation is in our sampling messages, where we use pre-selected keywords to make our sample smaller and more manageable. But this could have excluded quite valuable, potentially relevant articles. So we do recommend that more research should be done, and potentially research also comparing the COVID pandemic to other global health crises, so that we could better understand how pandemics and epidemics are framed in the news. Thank you.
Thanks, Corlia. It was good time. We're 10:30, and I think most of us have set aside an hour, so we have plenty of time for discussion. The only thing I would add to what you presented, which you touched on a few times, is in a way much of what we found was to be expected. I think you said that a few times. In terms of the newspapers we selected, the type of news they cover, there was a lot of confirmation rather than anything startling in what we found. I think that's the one thing to say. And then perhaps the other, just to pick up on your point, that one could have expected the media to play a more responsible role during the pandemic, and obviously we found that was not the case. Again, maybe that's not unexpected, because that's, well, what is their role in terms of public service versus their responsibility to their shareholders to generate revenue, whether it's a pandemic or not. So one could have argued that during a global pandemic, they might have taken their public role more seriously or more consistently, because I think we find a lot of variation in the reporting in terms of the different frames, but that certainly doesn't seem to be the case from our findings. But I'm going to leave it there and open up the floor for other comments, questions, criticisms. Peter, your hand went up very quickly, and Mahita's also up, so let's start with Mahita and then Peter.
Hi, that's very kind that you let me go first. I would happily have let Peter go first instead. Hi, everyone. Morning. Thanks, guys, for this paper. I've also had the privilege of reading a draft version of it. So I wanted to ask you, precisely what you brought up. Like, you mentioned the phrase "it was expected" quite a few times, and I think there's an opportunity there to kind of actually contribute to a critique of the political economy of news, right? Like, it may not have been your driving research question when you started the study, but your data may allow you to make an argument about how, like, the news industry functions as an industry, first and foremost, regardless of our democratic goals and ideals about the media's role in a free and fair society, right? Because I do feel like your data kind of reinforces what has very much been, the argument of the political economy of the news critique for all of the decades that work has been done. So, but somehow positioning that within the pandemic in this country, I think, is an original contribution. So I wonder if you guys could maybe, just even think out loud a little bit with what does it mean that you found things you expected, right? So then what is the theoretical framing that allowed you to expect those things, right? And to me, that would be the political economy of news making and journalism and etc. and the media in general. And then what might that allow you to say? How might that allow you to push forward a critique, right, of the power structures of news and reporting? Again, like I say, you may not have intended to make that critique, but I think you can. And I think, it's now more than ever that critique is needed as news media are increasingly privatized, resources are being stripped from journalists. So yeah, I do think there's something that you could do there critically, and I wonder what your thoughts are on that.
Thanks, Amita. Do you want to go first, Corlia?
I'm not going to speak to the theory. I don't know a lot about that. So, but I definitely agree. We didn't set out to do that, but it came out. So, you have to be responsible with your information and what you put out in the world. I would love to look into it. I don't know the news media and what happens very well. So I think that would be quite interesting, and we should definitely sit down and discuss that. Anita, if you want to be part of that discussion.
I think just few thoughts, Amita. I agree with you, and I think we haven't taken it far enough. I think in the paper there's a paragraph at the end that we kind of start to move in that direction, but I think we could do more, which requires a bit more reading. And yeah, it's shifting the perspective slightly, because so much was expected. In a way, the answers are not that exciting to the question, but then take it that extra step, as you say. Two things that occurred to me just while you were talking. One is, it would also be useful, if possible, and here we take guidance from others that know the media better than the landscape in South Africa better than we do, to think about whether there are community news outlets, whether those are radio stations or possibly newspapers, but I'll be surprised, but it could be. And to do a similar analysis, maybe as a second step, and see how they, report it. How does that compare? If we can have a group of them versus a group of newspapers, and see if there's that same variation, are there different frames, and then that might lead us somewhere along the line of, the different imperatives or different driving forces behind that type of media, which is more publicly focused then, and it would be against commercial media. So that's something to think about and explore, but I don't think we can do that in this paper, but it certainly for future work might be a avenue worth exploring. And then the other thing that I think occurred to me, and this struck me while we were writing, and I don't think we really unpacked this, is this distinction between the journalists who are doing the writing and the media. So the media, broadly speaking, the editorial process that happens, the decisions that are made by newspapers given their own strategic positioning in the market. So maybe journalists were more inclined to report responsibly because they were living this experience. But we don't know what happened in the newsroom. We don't know, whether those stories were pushed aside or were made more sexy or made more whatever. We don't know. There's kind of mixed headlines alerted me to that. Why would you have a mixed headline? On the one hand, someone's trying to say something that's calming and reassuring, and then at the same time you're trying to be sensationalist and alarming. So that mechanism, that newsroom environment, obviously we have no insight into, but it again is maybe worth mentioning and drawing a distinction so as not to almost make journalists feel responsible. I think they are maybe pawns in this mechanism, this political economy that you're alluding to. Okay, thanks, Mita. Peter.
Thanks, Mita.
Yeah, Mita has actually sort of asked my question, but let me extend it a little bit. Namely, we have the discussion, at least here, about given the sort of the downturn of science journalism, what is the role that science journalism, i.e., especially the journalism part, what role does it play in comparison to how the scientists or the scientific institutions communicate? And of course, we know that the media have these limitations, but in science journalism, at least, they aspire to the same kind of criteria of value that the scientists aspire to. So, given that you have, at least to some extent, already the communications in our previous project, in our the communications by the official administrations, i.e., committees or whatever, you know, the chief science advisor, this kind of thing. Given that, would it be worthwhile to compare those communications with the material that you have on the newspapers? The thing I'm getting at is, given the market relations that media have, the pressures under the economic pressures under which they operate, and especially now with the social media being there, one could perhaps see, in looking at the frames, looking at what they made out of these communications that they received, how they suffered in so to speak, the object, well, call it the objectivity or the kind, the tones, the contents, etc. How, what did they make of that? In order to come up at the end with, so to speak, a judgment about the role of the media in science communication or science journalism. What could be the role of science journalism? Is it possible, you know, to have that work up to the standards of science communication?
So, Peter, are you saying compare with two different groups? So, on the one hand, government officials, because they would have made their statements, and those wouldn't necessarily have been the same statements that were coming from the scientists, the committees that were established. And we know that that's the case, that there was sometimes disagreement amongst them. Or are you talking purely about the scientific community as a voice during the pandemic?
Yeah, I mean, I don't know. You know, there are these committees that were set up especially for COVID. In most countries, you have some kind of a task force that was supposed to concentrate their communications, you know, on COVID proper. So one could take one of these bodies, which is perhaps well, or one could take one of those bodies, and then either the science communication done by the chief health minister, or you know, probably the health ministry or whatever, wherever the policy was formulated, and or take I don't know if this would be applicable to South Africa, but maybe the sort of, I mean, for instance, we had the chief virologist.
Mm-hmm.
In the US, it was like Fauci.
Mm-hmm.
You know, these kinds of people. One would have to look at exactly, you know, what was political, and one could take, so to speak, one communication that has been tainted politically, and one that was more scientific.
Mm.
and then see how that compares to the development of the frames as you have it. I mean, I know it's yet another project, but I think it could answer an important question. Whereas now, I ask myself the same thing that Mahita asked herself. What was the surprise, so to speak?
Yeah. Yeah, I agree with that. I think it would be interesting. I think in the South African context, certainly the claim has been made by government that they took at least, I think it was 90% of the recommendations from the Scientific Council. So one would expect it to be some coherence between them, but that's a claim. It's not something that's factually known. So one could separate them out still and then see how the media responds. The only slightly tricky part would be whether there's actually whether the media is influencing, what's coming out. We can't assume that, the politicians and the scientists are working in completely a vacuum. But I still think it's, as you say, worthwhile to compare the consequence, or the subsequent framing after a statement is made or a scientific piece of information is pushed into the public domain about COVID. How is that then framed and picked up, and how does that change, if at all, over time? So I think, Corlia, for us at least, it's not surprising, I think, to hear these kinds of comments and questions, because I think we felt that way when we were doing the research, that this kind of confirmatory. Sorry,
can
go
I
ahead.
add, can I add something? Just one question that I had initially, and that is, have you checked if there are any similar studies made elsewhere?
Yeah, we have a full literature review. I mean, I just didn't cover it today. Yeah, we.
Okay.
Yeah, no, there has been nothing quite exactly the same, but I mean, we based our codes on other similar papers, so there has been quite a few.
Yeah, I think the thing, Peter, is just to respond to that. Two things. One is, I think our study is by one of, if not one of the longest periods that was covered. A lot came out sort of mid-pandemic, so they would cover 2 or 3 months, and so we've got a much longer time frame. But having said that, our study doesn't differ that much from the others, because they are generally, and kind of to our surprise, also quite descriptive. These are published articles, and they basically just say, these are the frames that the codes we used, this is the media we coded, and these were the frames we found, and that's the end of the story. And we kind of left thinking, okay, so what? What does that tell us? Where does that take us? So I think that's what we are now. We sense that we've added another piece to that puzzle of framing, but there's a lot more that needs to be done. We don't feel like we can just stop and say, well, that's the end of the story.
Yeah, and we have, like I said, I left out 2 research questions now with the presentation today because of time limits, but we have another research question where we asked to what extent did the news media rely on science to frame their stories, where we actually did look at the content of some of the articles to see if they make any reference to science or to support what they are stating. And I mean, it was lacking. It was actually quite sad that very little science is clearly visible in these articles. So our discussion goes a little deeper, where we kind of bring that research question with the other research questions.
Maybe I can ask Wilma, and sorry to put you on the spot, Wilma, but since you work in a scientific institution and you deal with the media on a fairly regular basis, and I know this is unscientific because it's your personal experience, but nevertheless, what was your experience of media contacting you, asking you questions, wanting more information that is of a scientific nature about the pandemic, and then what you actually saw in the media ultimately? I mean, was there a big disconnect? Were there any surprises, or was it pretty much as you expected, and so there's nothing from your perspective that's surprising in our findings?
Actually, it was a little surprising to me, but then I realized that I am also looking at it through a very specific frame. For those who don't know, I'm based at the medical faculty, and I am, well, one of my roles is to be media liaison between our experts and the media. So during COVID, sure, our media engagement, just like I think it probably, I can't even say tripled, it was probably tenfold what it usually was. So in my experience, there was a very big reliance on scientists and so on for information, but and also what I saw, obviously I didn't follow all the news coverage on COVID, but so yeah, my experience was that there was a lot of information based on, you know, or scientific comment at least going out into the media, but I don't have the overall picture because I looked at it from a very medical lens. So I can, from my experience, which is anecdotal, say that there was definitely an increase in the use of science, comment, and so on. But I can only comment on that part of the picture. I think where your research had a more broader look at the economic and the social aspects of the pandemic.
Okay, thanks, Wilma. There's a question in the chat about whether the lack of science in the articles was due to journalism or the field of journalism or science itself. And I would say Wilma's touched on that to some extent. I mean, there was plenty of science and journalists were engaging with the scientists. If there was a tenfold increase, it shows that there was certainly interest. And I know from another study that I worked on with Jonathan, who's on the call, on preprints, we saw plenty of uptake, both in terms of preprint, so science was more accessible, but also normal journal articles. I don't think the problem was so much on the science side. I think there was plenty of communication. My gut feel is it's more on the journalism side, and that's what we're picking up today. And maybe to be clearer, not the journalism side, but maybe on the media side.
Yeah.
We don't know whether it's the journalists themselves, although Peter's point is also valid about, you know, are these journalists or are they science journalists? And again, my gut feel would be that there were very few science journalists, and most of the articles were written by, I don't want to call them regular, but I don't know what the right term is. So, you know, regular journalists rather than science journalists.
And something I picked up, and I have no proof for this, so this is just an observation, is when a scientific article comes out and someone reads one little bit in it and they're like, this one caption here would make for great news headline. They nitpick from the science articles to support what they want to write about. So they don't often refer to the whole conclusion or the whole concept that they can take away from a scientific published article. So I had like fun during the pandemic when I read something to go back to an article and see what was actually in the scientific article versus what was in the newspaper or the online, whatever way I read it, the blog. Because again, don't know if it's journalists or the media as a whole, but they do nitpick. So I don't think that the fault is at the science that wasn't accessible during the pandemic. I think it was in a way to make sure the news gets read, and it did. I mean, I know people that don't care about the news, that just was constantly on the news in the pandemic, and people had to like actively get themselves off the news as not to go stir crazy, basically.
Just one thing that I noticed on the paper that I worked on with Peter, where we looked at different issues, but it kind of relates to what you just said, Corlia, that in other countries, like in the UK, I think in Germany to some extent, I'm not that familiar, it happened in the US, but it changed. Politicians and scientists would often appear together on television. I'm talking now as a media, not print media. But in South Africa, that hardly ever happened. The politicians would present, and the scientists would present in separate fora. They were never in the same space. What that tells us, I don't know, but it was just an interesting observation that they were kept fairly separate in the media. Okay, so we're coming to the end of the colloquium. Oh, Monica, there's still time for you to slip in a question. Go ahead, Monica.
I'm struggling with the technique. So thank you. This was a very interesting presentation. I've learned so many things about media coverage in South Africa, because obviously I'm from Germany and I've only been to South Africa once. I don't know very much about that. But I have maybe a final question, and it adds on what Peter said. In Germany, we had this big discussion of how obedient was the media to the politics, to the government, to the political measures, and not only focused on the question how science-driven policy was, or the politics decided, but it was more an overall discussion on how critical reflecting media should be. So maybe you have an answer to that. Did you find something or some references to, or critical references to policy measures in your frames, or was it a single frame and maybe I missed it?
So again, a little bit of context in South Africa, and I would say that these two things picked up a lot of attention in the media, especially early on in the pandemic. We didn't look for this as a particular frame, and this could have been a weakness because we used mainly the deductive approach, where we took frames from a previous study. We made only minor adjustments, and so we might have missed some of the nuances. But in South Africa, there were two political decisions that were very contentious. And the one was the banning of sale of alcohol. So there was no alcohol sales during the COVID pandemic at various stages. And the argument was that this would reduce pressure on the health services. So there would be fewer trauma cases, fewer road accidents, etc., if there was less alcohol, and therefore the hospital services would be able to focus on COVID. And actually, this was an interesting social experiment, because the government had a reason and a justification for doing this, where it wouldn't have been able to do that before. And trauma wards were empty. I mean, there were pictures in the press, and I remember, this is not from our study, this is from the media. I remember over New Year, where there was a particular public hospital that the trauma ward would be absolutely full to capacity over the New Year period, was almost empty. And that was because of the alcohol ban. So, but there was a lot of criticism of that. Partly it was understood, but partly it was also an economic issue. So banning alcohol has a huge impact on the economy, not only for the people that make alcohol and sell alcohol, but on the advertising industry that relies quite heavily on the alcohol industry, industries attached to the advertising industry, like printers and designers and those companies, and also tax. Tax on alcohol sales cuts revenue from the government, who desperately needed more money to deal with the pandemic. So there was one issue where we could look more closely at this tension, as you point out, between the media and politics, and how critical media was of these decisions. The other one was even more contentious, and that was the banning of cigarette sales. So we had no cigarette sales in South Africa for a period of at least, I think, 3 or 4 months. And this was highly contentious, because this wasn't just a health, it wasn't as easily justified. There was no evidence that if you smoked, you were more likely to get COVID, or that you were more likely to struggle to recover from COVID if you were a smoker. So the science wasn't backing up what is a political decision. Of course, the politicians scrambled around and they found some French study somewhere, I think, that showed, but it was one study, and so that they were kind of on the back foot. But that was the ruling, and so cigarette sales were banned. And again, I mean, people showed how many billions of rands were lost in tax revenue by the government because they banned cigarette sales, and there was no clear indication that doing so would actually reduce or lessen the pressure on the health services. And moreover, a lot of people needed. The claim was smoking for anxiety. It was a very anxious time, and smoking would help to calm. Not great for your health, but maybe good for your state of mind. So that was another very contentious issue, and ended up in the courts, and the media did report obviously quite heavily on that. So it could be, Corlia, that we could go back and look for specific stories that deal with those two issues, because I think this point that you make about whether the media is a critical voice of what was happening or not might become a bit starker than a general kind of assessment of how critical it was. I hope that answers your question.
Yeah, I can just add that we did have frames for government response, under which one of the subcategories was substance bans. So we did frame a code for it, as well as a code for law and politics, where policies and rules and things came under. So we did code for it. It just wasn't as what's the word?
Prominent.
Prominent, yes, as the other three categories. But I do agree that looking into it into more detail should probably be interesting, because I know at one point they were grasping at straws by saying, but when they people share the cigarettes, you know, they will. What was that song? Yeah. By that politician of ours, that song they created. So just to add to that.
So basically, the takeaway is there's a lot more work for us to do, Corlia.
Yeah, I'm okay. I'm ready.
We have to do more presentations to follow up. Thanks, Monica. So I think that's on. We've gone past the hour. So thank you very much, everyone, for attending. And we'll certainly try and get another colloquium up and running in the next month or so, and we'll send out invitations, and please feel free to spread the word and invite others to join in. It's not about numbers, it's about the quality of the feedback. And I think Corlia and I both benefited immensely from your comments today. Corlia, do you want to say anything in closing?
No, just thank you. We're going to add, and we are going to add some and look at some of the comments in the discussion, and then hopefully when we submit, you'll see the paper in the news. No, I'm joking. Just somewhere.
Okay, thanks everyone. Have a good weekend.
And hi, Dad. My dad's on here. Hello, Papa.
Yeah. Bye-bye.
Bye.
Bye.
Goodbye.